Let me start today by asking you a question many men never think they'll face. Have you ever felt a little embarrassed to talk about changes down there? Maybe it's waking up at night to use the bathroom more than once, or feeling a bit of discomfort that you can't quite explain. Maybe your urine stream just isn't what it used to be, or things seem different, but you shrug it off as just getting older. If that sounds familiar, you're not alone. But here's the truth. Some of these changes, especially after age 60, can be signs your body is trying to warn you about something more serious, something that too many men ignore until it's almost too late. I want to share a story about a man named Joe, one of my longtime patients and, if I'm honest, a bit of a stubborn soul. Joe was always the first to crack a joke in the waiting room and the last to admit when something was wrong. But one afternoon, Joe came into my office looking concerned. He admitted he'd started waking up twice, sometimes 3 times a night just to use the bathroom. His urine flow was weak, and he'd noticed a bit of discomfort in his lower back. Still, he told himself it was just age catching up with him, nothing more. "I didn't want to make a fuss, Doc," he said with a sheepish grin. But Joe's story is exactly why I'm sitting here today, having this important conversation with you. Because the symptoms he was ignoring, no matter how mild or embarrassing, were warning signs that deserved his attention. They were symptoms that, for some men, could signal prostate cancer. And while I know it can feel uncomfortable to talk about these issues, nothing is more important than your health, your peace of mind, and your future with the people you love. If we haven't met before, I'm Dr. Robert Jansen, and for more than 3 decades, I've devoted my life to men's health, especially those quiet, often overlooked problems that can have the biggest impact as we get older. My job, and my passion, is to give you clear, honest information in a way that's easy to understand, so you can take action, feel confident in your decisions, and protect your health for the years ahead. And that's why today's topic matters so much. Prostate cancer isn't something that only happens to other people. In fact, it's one of the most common cancers in men over 60. The good news? When caught early, it's often treatable, and men can go on to live long, healthy, and fulfilling lives. But the challenge is, many men miss the early warning signs, either because they don't know what to look for, or they're too embarrassed to mention their symptoms to anyone, even their doctor. Today, I want to give you the knowledge and the confidence to pay attention to your body, and to take action if something feels off. We're going to talk, in plain language, about 8 symptoms of prostate cancer that every man over 60 needs to know. And yes, some of them might surprise you. You might not expect back pain, or trouble getting an erection, or even unexplained weight loss to be connected to prostate health, but the body has its ways of sending signals. The earlier you spot them, the better your chances for a healthy outcome. I want you to understand, this isn't about fear. It's about empowerment. It's about being proactive, and taking your health seriously so you can keep doing the things you love, whether that's traveling, gardening, spending time with grandkids, or just enjoying a round of golf with old friends. Knowledge is power, and today, you're giving yourself the gift of that power. If you're finding this message helpful so far, please take a second to like this video. Subscribe to our channel, and tap the bell icon so you never miss practical advice that can make a real difference in your life. And I'd love to hear from you in the comments below. Just type, yes, if you think it's important for men to talk openly about these topics, or no, if you feel it's still too uncomfortable. I read every single comment, and your feedback helps me understand what you need to feel confident and informed. Now, let's circle back to Joe. After that first honest conversation, I encouraged him to go through a few simple tests. And I'll never forget the relief and gratitude in his eyes when we caught a problem early, before it became a crisis. That's what I want for you, not just the absence of disease, but the presence of confidence. Knowing that you listened to your body, took action, and protected your future. The first thing I tell my patients is this: not all changes are just old age. Some changes are your body's way of whispering for help. It might start as mild, occasional trouble with urination. Maybe you notice you're going more often, especially at night. Or maybe the stream is weaker than it used to be, or you feel like you're not emptying your bladder completely. These symptoms are often brushed aside or chalked up to a normal part of aging, but they're actually the body's early warning system. Sometimes, they can be signs of an enlarged prostate, a common, usually non-cancerous condition, but they can also point to something more serious. It's not just about urination, either. Prostate cancer can sometimes show up as discomfort in your lower back, hips, or even your upper thighs. These aches are easy to ignore, especially if you've had an active life or arthritis, but they're worth mentioning to your doctor if they're new, persistent, or unexplained. Joe's lower back discomfort was one of those early clues that we needed to look deeper, and I'm so grateful he spoke up when he did. You might be surprised to learn that trouble getting or maintaining an erection can also be a sign, not just of aging, but of underlying prostate problems. I know these topics aren't always easy to talk about, but bringing them up can make all the difference in the world. And if you ever notice blood in your urine or semen, don't panic, but don't wait, either. These are clear signals to get checked out as soon as possible. Sometimes, the symptoms are even less obvious. Things like unexplained weight loss or feeling unusually tired can sometimes be related to advanced prostate cancer. While these symptoms have many possible causes, the key is to pay attention to new patterns, changes that don't make sense or that persist for more than a couple of weeks. I want you to know, I'm not here to frighten you. I'm here to help you be informed, alert, and empowered, because that's how we protect ourselves and the people we care about most. And the sooner you recognize these warning signs, the sooner you can get the care and support you need. If you haven't already, please take a moment to like this video, subscribe, and let me know in the comments whether you believe it's important for men to have these conversations. Your support helps me reach more men who might need this information. As we continue, I'll share more about what these symptoms mean, how to talk to your doctor, and why early action can make all the difference. Remember, you're not alone, and it's never too late to put your health first. I'm Dr. Robert Jansen, and together, we're breaking the silence, supporting each other, and taking real steps toward a healthier future. When we left off, I was telling you about Joe, the kind of man who never wanted to bother anyone with his problems, least of all his doctor. But Joe's story isn't unique. So many men his age come to me only when their symptoms can no longer be ignored, when a nagging pain or constant trips to the bathroom have finally started to interfere with their daily lives. That's why I want to walk you through the real, everyday signs your body uses to alert you that something might not be quite right with your prostate, and why it's so important to take them seriously, even if they seem small at first. You see, the prostate is a small gland, but it plays a very big role, especially as men get older. It sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. As we age, changes in the prostate can start to affect how easily you can pass urine. That's why so many men notice things like a weaker stream, a need to push or strain, or the sensation that they just can't empty their bladder completely. It might start off as something you barely notice, maybe just a little dribble here or there, but over time, it can become more persistent. And for some men, this is one of the first red flags that something might be wrong. But it's not just about urination. One of the things that shocked Joe most was learning how many different ways prostate cancer can show up. He had no idea that his lower back discomfort, which he'd chalked up to just getting older, could actually be connected to his prostate health. When I explained to him that cancer in the prostate can sometimes press on nerves or even spread to nearby bones, causing pain in places you wouldn't expect, he was surprised, and a little worried. But that worry is what pushed him to keep an eye on other changes, to stay alert, and to keep the lines of communication open with me. Another symptom that often goes ignored is trouble with erections. Now, this is a topic many men find uncomfortable, but it's an important one. Erectile difficulties are often blamed on stress or aging, and while those things do play a role, persistent problems in this area can sometimes signal a deeper issue with the prostate or the blood vessels around it. Joe was hesitant to bring this up at first, but when he did, we were able to look at the bigger picture, and ultimately catch a problem before it got out of hand. Then there's the matter of blood, something no one wants to see. If you ever notice blood in your urine or semen, even just a small amount, it's a sign you should contact your doctor right away. Most of the time, it's not cancer. It might be an infection or a small injury. But it's always better to be safe than sorry, because in rare cases, this can be one of the more alarming early signs of prostate cancer. When Joe first heard this, he shook his head and said, "Doc, if I'd known that, I never would have waited so long." Of course, not all symptoms are so obvious. Sometimes, they're more subtle. You might start feeling more tired than usual, without any clear reason. Or maybe you notice you're losing weight, even though your diet and exercise haven't changed. While these symptoms can come from many different causes, in men over 60, they can occasionally signal something going on with the prostate, especially when they happen alongside the other symptoms I've mentioned. Here's something else to remember. A lot of men, like Joe, try to tough it out. They figure it's just part of getting older, or they don't want to waste the doctor's time with what seem like minor problems. But I always tell my patients, never ignore your instincts. If something feels different, if you notice a change in your body that doesn't go away, your best move is to talk to someone you trust. The sooner you bring it up, the more options you have, and the better your outcome can be. One of the most common myths I hear is that prostate cancer always comes with pain or severe discomfort. In reality, it can develop slowly, often with very mild or even no symptoms at all, until it's more advanced. That's why regular checkups, open conversations, and paying attention to even mild changes are so important. By staying informed, you give yourself the best shot at catching any problem while it's still small and treatable. This is why I encourage all my viewers, if you hear something in this conversation that sounds familiar, don't wait. Don't brush it off, and don't be embarrassed to speak up, whether it's with your doctor, your spouse, or even in the comments below. Your health and peace of mind are worth it. Let's pause here for a moment, because this is an important step for our whole community. If you haven't already, please click the like button and subscribe so you never miss a conversation that could truly make a difference in your life. And if you feel it's valuable to talk about these sensitive topics, let me know in the comments below with a simple yes or no. I read each and every one, and your feedback helps me create the advice you need most. Looking back at Joe's journey, I'm grateful he found the courage to speak up. Not only did it lead to an early diagnosis, but it gave him, and his family, hope, reassurance, and a real plan for moving forward. Joe's story reminds us all. When it comes to your health, being proactive isn't just smart, it can be life-saving. So as you reflect on your own health and your own body's signals, remember, there's no such thing as a silly question or a minor concern. Your body is wise. When it's trying to get your attention, listen. You could be giving yourself the best gift of all, a future that's brighter, healthier, and full of the moments that matter most. I'm Dr. Robert Jansen, and I'm here to guide you through these important topics, one honest conversation at a time. There's a kind of quiet bravery in admitting something doesn't feel right with your body, especially when the symptoms are personal, uncomfortable, or just plain awkward to talk about. As we grow older, it can be easy to chalk every ache, every extra bathroom trip, or every new sensation up to just age. But what I've learned from decades as a men's health specialist is that listening to your body, and trusting those instincts, is one of the most powerful things you can do for yourself and for the people who care about you. For Joe, having those open conversations changed everything. After we caught his prostate cancer early, he told me, "I wish I'd spoken up sooner. I feel like I got a second chance." He became an advocate in his community, encouraging his friends and neighbors to pay attention to the subtle warning signs. And the truth is, prostate cancer, when caught in the early stages, often responds extremely well to treatment. Many men go on to live long, fulfilling lives after their diagnosis. The real danger comes when the early, quiet symptoms are ignored or dismissed. Let's take a closer look at what those symptoms mean and why they matter. The first signs, changes in urination, like weak stream or frequent nighttime trips, are often a result of the prostate pressing on the urethra as it grows. This can happen with benign enlargement, but it can also be a red flag for cancer, especially if symptoms appear suddenly or worsen quickly. Pain in the lower back, hips, or thighs can signal that cancer cells are affecting nearby nerves or bones. It's not the sort of pain you get after a long walk or working in the yard. It tends to be dull, persistent, and not easily relieved by rest. Erectile difficulties, though hard to talk about, can sometimes be the body's way of alerting you to changes in blood flow or nerve function caused by the prostate. Blood in the urine or semen, even once, is always worth mentioning to your doctor. And then there are the less obvious clues: fatigue that won't go away, or unexplained weight loss. These can sometimes mean the body is fighting a bigger battle behind the scenes. I know that hearing about these symptoms can feel overwhelming or even frightening. But I want you to see this as a message of hope, not fear. Because every symptom is a chance to notice, to act, and to get the help you need before a problem gets serious. Think of your body as a trusted friend that never lies to you. When it whispers, pay attention. When it shouts, act. Now, you might be wondering, if I notice one or two of these symptoms, does it always mean I have prostate cancer? Absolutely not. Most of the time, especially with things like frequent urination or mild discomfort, the cause is something far less serious, such as an enlarged prostate or even a urinary tract infection. But that's exactly why it's important to check in with your doctor if symptoms are new, persistent, or worrying. When you speak up, you allow us to rule out the most dangerous possibilities and get you on the right path, whether that means simple reassurance, a checkup, or further testing. That's what Joe learned. The peace of mind he gained from early diagnosis, and from knowing exactly what he was dealing with, was worth everything to him and his family. He told me that the hardest part wasn't the diagnosis itself, but the weeks he spent wondering and worrying in silence. Once he knew the facts and had a plan, he felt empowered again. If you found yourself nodding along, or if any part of this conversation has struck a chord, please take a moment to like the video and subscribe to this channel. These simple actions help us reach more men, and your support means the world to me. And if you think it's important for men to talk about these things, leave a yes or no in the comments. I read every comment, and your voice helps shape what we discuss next. Let's not forget the people around you, too. Sometimes, it's a spouse, a partner, or even a good friend who first notices the changes. Maybe they've mentioned your increased bathroom trips, or asked why you're so tired lately. Listen to them, and let them support you. These conversations, while sometimes awkward, are an act of love. And if you're feeling nervous about seeing your doctor, I want you to remember, our job isn't to judge, it's to help. We want to hear your concerns, no matter how small or personal they seem. It's far better to talk about a symptom and find out it's nothing serious than to wait and wonder. Joe's journey didn't end with his diagnosis. With treatment, regular monitoring, and the support of his family, he not only regained his health but became a source of strength and encouragement to others. He turned his experience into hope, not just for himself, but for every man who might be watching today. So, as you settle into your evening, I encourage you to reflect on what your body has been telling you. Is there a symptom you've been ignoring? Is there a question you've been too embarrassed to ask? Know that you are not alone, and that help and support are always within reach. Each day is a new opportunity to care for yourself, to listen to your body, and to embrace the future with courage and optimism. I'm Dr. Robert Jansen, and I'm grateful to be part of your journey to better health. Thank you for trusting me with these important conversations.